A lot of times what does happen is patients come in for pain or a specific complaint, and then somehow the discussion circles around to weight loss. Yeah, I think that's a function of one, our like cultural stigma, but also when a provider doesn't know how to provide an answer for someone, it's easier to blame the patient and say, well, if you just lost weight, you wouldn't have pain.
There are publications after publications in peer-reviewed journals that document how nurses, healthcare workers, and doctors carry bias and translate it through their practice onto the patient. How many people who have any condition at all would seek a person's counsel, knowing that when they got there, that person will be looking at them like the cause of this condition is their fault and the solution is their responsibility?
What should be our expectation when we go to the doctor? How should we expect to be treated? I know it's a hard question.
Yeah, the slippery slope, it's not in medical and physician assistant and nursing school curriculums in terms of how to provide affirming and safe care for people who are in larger bodies. Everyone should be able to expect that they can go to a healthcare provider and receive safe and affirming care and to not be shamed.
I've been thinking about the amount of shame I carried at like my first Weight Watchers meeting at like 9 years old, thinking I did this to myself. And when I think of that now, I'm like, how did that little girl think she did this much damage?
Fatness is not just about being fat. It's the way we continue to other people in society, because in the country that we live in, we've always needed a way to distinguish who is better than someone else.
It is prejudice. We categorize an entire group of people and we condescend them all based on an experience that they have that we've never had. Each person is an individual, and we need to treat people as individuals and not as labeled groups of diseases.